The Ministries of Education, Health and the National Council for Higher Education recently met and concluded that medical and health training institutions are a source of specialized human resource for the health sector. They agreed that they should be reopened, starting with finalists and postgraduate students on Friday 13th August. The guidelines set are that not more than 33% of students should be at school at any time, interviews and admissions of new students to wait, standard operating procedures to be observed, monitored by the Ministry of Education and Sports, ensure that students and staff are vaccinated, parents requested to provide masks and sanitizers, and institutions will be required to work with parents to provide medical and psychosocial support for students who contract COVID-19 or other illnesses. But are the institutions ready? At Chibuli Muslim Hospital Health Training Schools, the training rooms have been arranged and are waiting for the arrival of 200 learners.
The students are not breaking off. So they are coming back to finish the 3 weeks of the previous semester. They do the exams and then transit directly into the next semester. So basically we shall be doing revision and finishing up the 5% that is remaining. So Monday or Tuesday we shall make arrangement for the vaccination. Already booked.
Makerere University, which runs the biggest number of medical and health teaching schools, has been largely on open, distance and electronic learning, ordeal, for medical students, but most of the learners are already placed.
Even before the lockdown, they had been distributed. They were actually doing their assessment there. So they were caught up in the middle. So it is easier now for the clinicals, year 3 to 5, and we have agreed. We had a meeting with the ministry the other week, with the National Council for Higher Education, and the Senate sat yesterday and approved the program. So the clinical years will return in a staggered manner, starting with the finalists, the 5th year, and then the other years will also come. So we are going to give them residence.
So we are set to start to receive them on Friday, inshallah.
These medical schools say they do not expect hardship in following most of these guidelines as they target medics and already have partnerships with hospitals in case of COVID-19 cases.
It's part of their training, naturally. So it is expected that we shall not have any problem, and they will be scattered into groups in various health centers.
As the clinical students continue with open, distance and electronic learning, awaiting the further easing of COVID-19 restrictions, Deputy Vice-Chancellor Dr. Umar Kakumba says online learning may be the future.
So I think that's an opportunity that will definitely continue, and it will also ease the preparedness of the academics. Because once you have your lectures recorded and designed in video and audio and they are on the system, you don't have to juggle through running up and down to come to be physical in the class.
Uganda has 103 nursing schools and 20 universities teaching health-related courses. Edward Muhumza, NTV.